We have a broad range now of oral medications. There are quite a few that have been approved by the Food and Drug Administration. And I would say they differ largely in their adverse effect profile. They're rather similar in terms of efficacy, with the possible exception of clozapine, which is approved by the Food and Drug Administration for the treatment of treatment-resistant schizophrenia and patients also with suicidality. But the other non-clozapine drugs are generally similar in efficacy. So we would make some distinctions based on adverse effects, and there it becomes important, again, to understand the individual patient, what side effects might they be vulnerable to, and what side effects are they most concerned about. Well, I think there are many challenges in using oral medicines. Probably the most significant is the fact that patients have a difficult time taking oral medicine on a long-term basis. And that's true in any chronic illness, not just schizophrenia, whether we're talking about diabetes or hypertension or epilepsy or asthma. Everyone has trouble taking medicine on a regular basis. And so I think when we use oral medicines, we're not really sure whether our patient is actually taking them or not. And I'm a big believer in the use of long-acting formulations because we can feel much more comfortable in the knowledge that the patient is actually getting the medicine. With oral medicines, we really don't know. I mean, even if the way we usually try to find out is by asking the patient if he or she is taking the medicine, and they're not always in a position to even report accurately, because I know when I've been taking medicine, there are times where I'm not sure whether I took it that morning or not. I forget. And, imagine someone who is struggling with an illness like schizophrenia, it becomes even more of a challenge. So I think that is one of the biggest challenges with oral medicine. We don't know exactly how adherent the patient is. And then that leads to a lot of confusion about, is the medicine working or not? Is the patient having side effects or not? Because one thing that can happen if someone stops taking their medicine, for a few days and then decides to go back on it again, then suddenly they have a side effect that they didn't have before, and it can get very confusing. So I think those are some of the challenges with oral medication.
Dose adjustments and dose frequency of oral medications have a relationship to adherence. We know that the more complex a treatment is, the more doses per day are needed, the more complex it is for the patients to follow, who often have cognitive problems, who may be ambivalent about taking the medication, who may not always have a caregiver being with them when they need to take the medication. So the less medication needs to be taken, the less often, the better, and the simpler the regime, the better. And here again, long-acting injectable formulations reduce the ingestion of medication from 3, 2, or once daily to maybe once every 2 weeks, every 4 weeks, 6 or 8, or even every 12 weeks. Because of the simplicity of the long-acting injectable medication treatment that reduces the time that patients can be ambivalent or reject or forget medication, the adherence is clearly higher with long-acting injectables than with oral medications. Patients have to only consider whether they want or don't want to take the medication every 2, 4, 6, 8, or 12 weeks. And very importantly, since non-adherence is immediately visible to both the patient's prescriber, but also to family members if they can be reached, patients can then be brought back before relapse occurs, and adherence is assured more likely even in patients who are trying to stop the medication.